Hello, everyone, and welcome to Day 2 of our ABAC Digital Symposium 2021, Accessing Innovation to Reopen APAC Trade and Markets. I'm Jan De Silva, Canada's representative to APEC's Business Advisory Council, or ABAC. I also am the 2021 chair of ABAC's Digital Working Group. Over the past year, the pandemic and its impact have been the primary focus of our entire Business Council as we shared information and worked to consider solutions to mitigate the conditions of COVID on our businesses and economies. Our Council's discussions were, in fact, the inspiration for this summit, to share emerging best practices with an invited audience who have the interest and capacity to adopt and transfer these ideas, programs, products, and services into action. For reopening our economies is not a winner-takes-all race. The more countries that bring workers and customers back, the faster our connected global marketplace will recover. Deploying and enabling innovative digital solutions within our economies is key to enabling recovery. We're delighted that this 3-day symposium has attracted attendees from all 21 APEC countries. We're joined by government and private sector leaders, academia, and innovators. At our opening session yesterday, we heard from ministers responsible for trade, economic development, and the digital economy from Canada, Chile, New Zealand, and Singapore. Key takeaways from that discussion were their reflection on the opportunity digitization presents to level the playing field and market access for smaller nations and smaller businesses. But to realize this opportunity, we need to support the digital readiness of our micro, small, and medium enterprises and secure collaboration across nations on interoperable regulations and data sharing. Over the next 2 days, we'll connect you to the innovators and solution providers of more than a dozen pilots, projects, and solutions currently being deployed around the world. Each solves for a different challenge facing our connected economies, be it the reopening of business travel, the digital transformation of MISMEs, digitizing our trade and supply chains, or building infrastructure that delivers multiple wins. And in addition to panel discussions on these 4 themes, we're offering breakout sessions after each panel, which allow you to connect directly with our panelists and their organizations for a deeper dive into their initiatives. Tonight's first session is tackling the reopening of business travel. And without question, travel and tourism is the sector that has been hardest hit by the pandemic. Since the outbreak began, more than 90% of the world's economies have introduced some form of travel restrictions, bringing business travel to a near standstill. In 2018, business travel spending exceeded $1.4 trillion. That's nearly a quarter of the world's travel and hospitality sector. That's a big macro number, but the even bigger pain is very much felt at the local level across our markets. Using my hometown of Toronto as an example, pre-COVID, Toronto welcomed 28 million visitors to the city in 2019. That's 28 million customers, not just for airlines and hotels, but also for our retailers, large and small, restaurants, bars, live theater, concerts, and major sporting events. 28 million customers who spent $6.5 billion in our city in 2019. COVID cost us those 28 million customers in 2020 and is costing us 28 million customers again this year. In the face of our devastating global health crisis, international travel will definitely take longer to regroup. Our leaders and public health officials are hard at work trying to contain and overcome the crisis. Closed borders, mandatory quarantines, testing and tracing protocols, and possible vaccination passports are on the minds of our leaders. This is the challenge our first panel is tackling, the reopening of global business travel. Here to introduce our panelists and moderate our discussion is my good colleague, Tiao Lei Lim of ABAC Singapore and the very accomplished chair of Accenture Singapore. Over to you, Lei Lim.
Thank you, Jen, for that introduction. And it's just so great to be here this morning moderating this panel. I think we all would acknowledge that 2020 has been dubbed the worst year for travel in history. And rather than validate that, I look forward very much for this panel to be forward-looking. And in fact, what a wonderful time it is this week, because looking at the news, there's just so much that's been happening all around us. For a start, on a global stage, IATA, the International Air Travel Association, with 290 airline members, is launching a travel app. And Singapore Airlines will be the first carrier to be using this app on the Singapore to London flights on March still. China launched the issue of its vaccine passport that shows details of travelers' COVID-19 inoculations and antibody test results. And then, of course, right here in Singapore, in a facility called Connect at Changi, which essentially allows business travelers to come and meet the Singaporean counterparts face-to-face across an airtight glass barrier or glass wall, saw its first group of visitors arrive on Tuesday. And so governments and countries and companies around the world are rising to the challenge before us. And these are just a few of the stories that abound in the press. We all know that innovation happens when there are problems to solve. And all of these stories happen because of people like our panelists today who are living on the front lines of innovation, driven with a purpose to enable and accelerate the return to travel globally. And so it's my pleasure to introduce the first round of innovators. As I introduce them, they will each give a short presentation of what they have developed to help reopen business travel. Following these presentations, we will have a panel discussion, and there will be opportunities for all of you to be posting questions to the panelists. Please submit your questions at any point through the Q&A feature on the right side of your screen. Following the panel discussion, there will be speaker booths where you'll be able to continue your dialogue with each of the speakers. So start thinking about each of the content areas and whose speaker booth you'd like to join post this hour. So first, let's move on to our first speaker, Dr. Chester Drum, who's based in Singapore. Dr. Drum is an assistant professor at the National University of Singapore and a consultant cardiologist at the National University Hospital, where he helps care for COVID-19 patients. Today, he'll speak about how we can store vaccination records and other medical information locally on our phone. So over to you, Chester.
Thank you very much, Leilim. So I understand we're live on the slides. Is that correct? Okay, excellent. So I think we can go to the next slide. So I'll talk about essentially an overlap of financial technology and healthcare technology. So my career has been in complex measurements of patients and how we treat that informatically. We've applied some of those technologies to a completely decentralized approach to medical information. And of course, in international travel, this is critical, especially as we deal with economies underneath the GDPR regulatory framework. So the first thing I'll say is that the application and technology is the easy part. The network is the challenge. So to that end, we are a public-private partnership with the International Chamber of Commerce. And so this is with John Denton, the Director General, to who I am a special advisor. And they, of course, represent all chambers of commerce around the world, ultimately representing 45 million businesses. Their expertise is for the last century. They have made international trade rules in addition to adjudication courts. So they provide our geopolitical access throughout Europe, in Asia, and Latin America, and the United States. International SOS, I think many people on this call know this company as well. They have an international network of 90,000 network clinics. They, for example, do the medical services for the Beijing Olympics. They do the medical services for the Department of Defense. They have the largest medical network in some of the most obscure places around the world, They provide our clinical backing, again, at a network level. And I think many of you work with SGS, who's a very large quality inspection and services firm. Next slide. So that provides a fundamental network to create global change. The technology solution is one of it's an end-to-end solution that starts with information on the part of the issuer. So often that's the laboratory or clinic that is then managed as a series of hashes. The architecture essentially manage those relationships within a blockchain structure, and we even use a public blockchain while preserving the privacy and right to be forgotten requirements of GDPR countries. The network itself extends. We do work closely with the IATA group. We have good connections within the World Economic Forum, and I myself am on several committees at World Health Organization to help guide those ultimate standards. We also have a position with the International Standards Organization to make sure that the work we do as a global community perpetuates into a permanent standard for the protection of health data. Next slide. This is an example from International SOS regarding their clinical network and where we can draw from. The most important things isn't that they have clinics in London, it's that they have clinics in Angola. So you can truly accommodate both underserved and first world economies as well. Next slide. So we've taken the approach of working with airport networks. So there are large companies that own lots of airports. ADP is an example. So they started owning Charles de Gaulle and did a good job, and now they own a wide range of networks within their airport network. Vinci Network is another airport that we work very closely with. By working with the corporate structure for airports, it's easy for us to help guide the standards by which healthcare information is indeed recognized. And I think this month you'll see a large program that will come onto line within the ADP network. I know today we're launching an operations for Paris to all the surrounding territories in France using the same blockchain network. Next slide. We can skip this one. Next slide. So again, this just emphasized the very simple cartoon of the blockchain structure that we operate under. We can go into more detail on this in the discussion section. Next slide. And one of the secrets to our success is we have multiple issuance protocols. So if you really want to make the system work, every lab, every clinic has a different way they want to report information. That can be an API system. It can be an HL7 standard. Sometimes it's exporting a comma-separated values spreadsheet, and you approve from that. There are many labs who only have the ability to do that. Our current protocol with the World Health Organization, which is in place with their staff in Geneva, uses its own file export standard. So we have multiple ways to accept information into the authentication system, and then of course we can provide authentication at different levels as well. So the good news is Singapore is very advanced in this. So the ICA and GovTech have come together to create a technological standard, which is truly one of the first in the world to be able to provide this service. On December 21st, we were one of the first technologies to bring a Japanese tourist through an actual ICA gantry that did an electronic approval of a foreign medical record. It's very difficult to do, and Singapore deserves an enormous amount of credit. We're working, we have integration programs with CETA and Amadeus, which are two other large companies, and are currently working with the Customs and Border Patrol as well in the United States. Next slide. So these are just some of our stakeholders. We can come back to specific pilots if it's relevant. One Singapore connection that's quite nice is Affinity, for which we have an affinity. So we're working with them quite closely in terms of some of their standards going through regional airports. Next slide. That's fine. I can stop there, and we can also talk about some very specific programs. Maybe if you just go one slide further, I'll talk about one network that we're going to launch this month, which is quite relevant for APAC. Next slide. Next slide. Okay. Steph, I thought you'd add some slides after the thank you slide, but so I'll just say we do have a large program coming on that's centered around San Francisco Airport and Los Angeles Airport that will communicate to Hong Kong and of course Singapore as well, and Charles de Gaulle. And so the French government has been good enough to include our technology within their sovereign recognition. And then our presence in Rome as well. So we're really excited to finally start getting enough nodes to create that network effect. Again, the International Chamber of Commerce is helping us propagate this further through the EU as they consider some of their global standards as well. So I'll stop there to make sure everybody else has plenty of time. But I can talk about how much fun it is to work with so many interesting stakeholders. I can also offline tell you the realities of working with so many stakeholders. But by and large, it's been a big adventure over the last year.
Thank you, Chester. I'm sure we will have many questions for you. But in the interest of time and just to make sure we hear all of the speakers, I'm going to hold my own questions for you until the Q&A session, and maybe transition to our next speaker. And we welcome CEO and founder of Prenetics Group, Danny Young. As a serial entrepreneur, Danny is no stranger to identifying issues in our world and introducing disruptors. So today he will speak on how he's helping significantly scale up the testing of the virus. We're glad to have you, Danny, and over to you.
Great. Good morning, good evening, everyone. Name is Danny Young. So let's just give a quick background about Prenetics-wise. We started back in 2014 as predominantly a genetics testing company. We own and operate our own laboratories globally. So certainly when the pandemic hit last year-wise, there was a lot of uncertainty. There was a lot of, we actually were not sure what we would do with the business. And so certainly when we started thinking about COVID, so we actually wanted to just offer something to the community that actually provided COVID testing that was easy, accessible, and that made sense, right? Because I think, certainly here in Hong Kong, at the start, when last March, when COVID was just, beginning to outbreak, it was very difficult to just do COVID testing. You actually had to go to a hospital. It was $3 to $4 grand HKD. So when we actually started doing COVID, it was actually to offer a solution that we can actually mail the kits to someone's home, get it back into our laboratory, and the results get sent back out in 24 hours. So we started with that. The volume was very minimal initially. And then in the UK-wise, last May, we then actually were able to partner with the English Premier League and actually provide testing for their players, coaches, and media. And so that actually enabled their season to return back to normalcy, the training and certainly the rest of the season. So now when it relates back to travel, of course, certainly travel has been highly, highly disrupted, due to the pandemic. And certainly what we've been able to do thus far in the last year, we have actually been able to set up testing sites in airports globally. So certainly right now, just for sharing reference-wise, we actually converted a smoking lounge in the Hong Kong International Airport to be our ISO 15189 accredited laboratory. So when passengers actually are looking for departure testing, they can just go to the airport, and basically within 1 hour, get their test results via rapid PCR test. In the UK, we also operate 6 different airports: Heathrow, Manchester, Luton, Stansted, and a few others. And the same thing, people can actually arrive to the airport a little bit earlier and then get their test results in 1 hour and then basically be off to their journey. So in total-wise, we've already processed roughly about 1.5 million COVID tests globally since the pandemic started. And when we think about the future, of travel, and then certainly I think there's a lot of questions in terms of vaccines, and certainly we believe the vaccines are a great start. In our conversations with both governments and airports, it seems that testing will definitely be still a key standard and a requirement, even with the vaccine. The challenge previously with testing is that basically it requires a PCR test. That is actually really cumbersome, takes a long time back to the laboratory, not so scalable. So certainly that's where we've been spending lots of efforts on both R&D as well as the technology piece, as well as team and scaling up our operations to be able to do rapid testing. So this actually started last year, because last October we actually acquired a company from Oxford University that actually had developed a rapid COVID-19 test with results in 30 minutes. So right now in our company phase, we're looking to scale that globally, and certainly airports is one of the key areas that we plan to launch this technology, because certainly I think the challenge is previously this takes too long and it's too costly, then it makes the whole process very inefficient. But now we do know that we have the technology available. It's cost effective. Where we're talking about a COVID-19 test, right now it can be done for roughly 50 to 60 USD, and results can be had in under 1 hour. So that's a significant breakthrough, significant opportunity to actually help resume travel on a global basis. And certainly when we're talking with governments, again, globally wise, it seems that testing and vaccines will be complementary to one another, and for a minimum until through the end of 2022. And so that's just what we've seen. So certainly I think that gives everyone an idea wise. I think for us, Prenetics wise, we've been incredibly busy over the past year. Right now our team is approaching roughly about 400 people. So I think we've been working day and night on testing for travel, as well as testing for the community, to provide great peace of mind, and certainly to make sure the individuals that are positive are identified and out of the community. So that's it for my sharing wise, and certainly I'm sure there will be many questions later on in terms of more specifics in terms of what we do and how we are helping the community.
Thank you, Danny. Maybe just to reflect on what Chester and Danny, you've been talking about, I guess the question that I have as a non-medical practitioner is that I noted, the latest data is around 305 million doses of vaccines have been administered around the world, and yet every other week we read of perhaps new mutations of the virus. And so the question is, how dynamic do we need to be in terms of how we deal with this and how we capture the vaccine information? I mean, Chester, how are you thinking about it?
So the best group that I work with in this regard is, so the World Health Organization has a committee specifically on this question, which is the Smart Vaccine Certificate Working Group. Their guidance is at this time still internal, but it'll be released presumably within April, which is very, very fast for WHO. But I could certainly speak broadly, there's a core data set for the valuable information that's required for vaccine documentation, and there aren't any big surprises there. Is what you would imagine it would be. The interesting aspect is how you bind that information with identity. So on one hand, you would love a large digital identity system where you can have a permanent reference to a medical record that would go all over the world. That would be great, but that creates a lot of problems. And there are many individuals who would be disenfranchised if you enacted that. So how do you deal with the different strata of society is a big concern of the global guidance. However, the content, the data content of how you record the vaccines, I think that will be relatively straightforward.
Thank you, Chester. I think we are now well positioned. We've got two components in the entire value chain. We've heard from Chester with the ability to capture the information. We've heard from Danny in terms of he's the source of some of that information. And now we move on slightly to a different track with Jason. Jason is Senior Director at the Government Technology Agency in Singapore. As a Senior Director, he drives government transformation through digital technology. And I am very familiar with the stuff that he churns out because I end up being a beneficiary of all of that. And today he'll speak about Trace Together, the world's first national Bluetooth contact tracing app. Over to you, Jason.
Yeah. Thank you, Leyland. So just a bit of additional background on the GDS team at GovTech. We are a collective of some 400 developers supporting multiple government agencies. The footprint that GovTech has covers something like 2/3 of the government agencies in Singapore, and we're very much in the digital transformation space. So let me get the next slide up. And since I'm in the digital transformation space, I just wanted to share with you some of my favorite memes in the last year, and this is one of them. So next, I think many of us can actually agree that COVID-19 has shown a spotlight on the need to digitally transform the way we work, live, and play in order to adapt to the realities imposed on us by the pandemic. And as a result, we've become incredibly busy at GDS and GovTech over the last year. In some respects, Singapore has benefited by being one of the first few countries outside of China to begin surveillance and to report cases of COVID-19. Let me get the next slide up. So we reported our first case on the 23rd of January last year. And that immediately caused some of us here in GDS GovTech to think about how to apply technology to the fight against this mysterious virus emerging out of China. And the result is Trace Together, building from our experiences with SARS and with a number of epidemics that have happened since 2003. Trace Together, I think, as Leyland mentioned, is the world's first digital contact tracing program. But more than an application of tech for public good or tech for public health, Trace Together is also an unprecedented national social experiment. We are effectively asking whether ordinary citizens will trust and participate in such a system in large enough numbers so that collectively we can contribute in a socially responsible way to protecting ourselves, our loved ones, and the community around us from COVID-19. And we developed this system with the help of both private and public partners, launching it within just 8 weeks of when we commenced work. Shortly after, we announced plans for physical devices to complement the mobile application. And we've also worked with private third-party device manufacturers to expand the coverage of the program amongst the elderly as well as the digitally excluded. And these are, I think we can understand, groups that tend to be correlated with adverse outcomes from a COVID-19 infection because of social inequities. I want to make the point here that Trace Together is community-driven, and thankfully public trust levels in Singapore have remained high throughout this pandemic. We saw this because within the first 24 hours, more than 10% of Singapore residents downloaded and installed Trace Together on their devices. And today, some 90% of the population is participating in the program. This has contributed to a dramatic reduction in the time taken to trace close contacts of COVID-19 patients from 4 days to less than 1.5 days. The precision of the system is also relatively high. More than 10% of the close contacts that we identify through Trace Together turn positive themselves. And this is a rate that exceeds what is possible through just manual contact tracing alone. We didn't dare believe that we would succeed in this manner when we first started this journey, but Trace Together's experience, I think, has also informed and inspired the tech companies like Apple, Google, to build a similar system. VMware also has an alternate system, and today there are more than 50 digital contact tracing apps deployed worldwide, some incorporating code that we published and shared with the world. Next, please. Let me just take a step back, though. Dealing with the disruption of COVID-19 is more than just about contact tracing through novel technologies. In order for us to safely reopen our economies and indeed to resume global business travel, many other initiatives will be needed, all of which will see technology being heavily relied upon to drive timely and broad-scale implementation. So first, in terms of test, trace, and isolate, in terms of that mission, besides Trace Together in Singapore, we have also developed Safe Entry, which is a national QR code check-in system that accelerates the tracing of contacts who might have been exposed to the virus at specific locations. And so you're thinking about fomite and environmental contamination risk here. And while not groundbreaking, I think we are seeing such systems roll out around the world. The UK has released something similar, Australia, New Zealand, and a number of other jurisdictions, some of which have also started to integrate these functionalities into their digital contact tracing systems. But I just want to make the point that even though these are really sexy initiatives, Safe Entry, Trace Together, they're just the visible tip of the iceberg. What's really important is to bring the whole of the government and public health apparatus together. So under the water surface lies the means and will to integrate systems and data from various sources. So for example, all positive COVID-19 test results in Singapore, whether it's a PCR test, an ART test, they are all funneled into a secure database pipe that's operated by the health authorities. And then they are used to trigger requests for uploads of Trace Together data, check against the Safe Entry database to coordinate ambulance and quarantine operations, as well as other medical follow-up actions. The second area that's covered on this slide in the top right here is that besides responding to the spread of the virus, we also need to mitigate the transmission of the SARS-CoV-2 virus through social distancing, wearing of masks. And there was initially, in the first week, an announcement of a national mask distribution campaign. And really, this is to address anxieties and fears by residents who are concerned about gaining adequate access to mask supplies that were running short. And so to manage anxieties, we rolled out an information portal called MaskGoWare. This was rolled out in under 12 hours, and we used it to direct residents to the nearest distribution points with up-to-date information about stock levels as well as the opening hours. And since then, we've had additional distribution exercises to provide equitable access to key in-demand resources. Third, with vaccination, and I think we're going to talk about that, we recognize the importance of a coordinated global effort, and Singapore is co-leader with Switzerland on the WHO initiative called COVAX. We call it the Friends of COVAX initiative. Domestically, we've also recognized the importance of, again, distributing and ensuring the efficient distribution and take-up of vaccinations by the population. So we've developed a central booking system that manages the priorities for different tiers of residents, linking back to a national immunization registry to ensure that any adverse reactions are tracked, properly investigated, and the deployment is effective. And I think Chester mentioned earlier that the key here is to tie all of this information back to digital identity. So on that, I just wanted to say more information on some of these solutions. You can access them through the QR code that's on the bottom right of the screen. But where identity and health certifications come in, I think I'm really excited to say, as countries begin to get a handle on contact tracing and vaccination, our attention and the attention of colleagues like AOK Pass is increasingly refocusing on what I'm sure will prove critical for opening of travel between countries. And if I can just pull up the next slide. In this space, I just wanted to share and provide a little bit of texture to what Chester mentioned briefly. The local standard that we've developed in Singapore and that we're hoping to work with IATA as well as ICAO on, the WHO, is called Health Certs. This is an open source framework. It uses a blockchain very similar to what Chester mentioned earlier. And we hope to reduce implementation hurdles for the rapid adoption of such credentials by not relying on proprietary software. So domestically within Singapore, we've actually already issued public health directives for all clinics that provide pre-departure tests for COVID-19 to issue certificates of the test results by digital means as a default. And again, like AOK Pass and like many other standards in this space, we only publish cryptographic hashes. And so that allows us to comply with the right to be forgotten, as well as the privacy and security of personal medical data can be maintained. If you are interested in this, I've actually invited my colleague, Stephen, who's spearheading our efforts in this space, and he'll be at our speakers booth later on to share more of his experiences and thoughts with you, whether formal or unofficial, given the diversity of players that we've got in this space. So I think lastly, if I can just pull that last slide up, I hope in this short presentation, I've been able to provide an overview of the types of tech-enabled solutions that we've brought together to support Singapore's economic reopening, and hopefully provide a sense to the audience here about what it would take for us to safely resume global travel, whether for business or for leisure. So please do check us out at the speakers booth later on. I've got some QR codes here where you can learn more about Singapore's Smart Nation initiative and also about my organization and my team. I'll be happy to address any quick questions now, and I also look forward to the panel discussion later on. So Leyland, over to you again. Thank you.
Thank you, Jason. I think what you've just described, by now I hope everyone starts to see the different pieces hanging together. We've got the vaccination that Danny talked about, got Chester's solution that actually captures and authenticates and validates that information. Jason spoke to how we keep the communities safe, and that's really an important part. And so now I would, it's my pleasure to introduce the fourth element to this solution, because if cities are safe and when we are ready to reopen, we need someone to connect them. And so Rafi Barukim is Senior Vice President and Chief Experience Officer, which is amazing because I think technology can solve problems, but sometimes when we try and be too safe, it detracts from the experience with just massive overloads of information and checks and so on and so forth. And so I'm really looking forward to hearing more about your identity management solutions for public safety and law enforcement. And you'll speak to today, I think you'll speak to the topic of biometrics tech for seamless and hands-free travel experience. So over to you, Rafi.
Thank you, Lei-Lin, and my gratitude to the ABAC for inviting me, and it's an honor to be part of this distinguished panel. So if you can go to the next slide, please. So what I'd like to be able to talk about today is that two implementations that NEC has done, two live implementations that has assisted in resumption of the travel. And one of these implementations, and keeping in mind the safety of the traveler, also the airport employees, as well as the destination cities. The first one that I have a video on that will shortly show is the implementation we had in the state of Hawaii. As we know, Hawaii's economy is highly dependent on travel and tourism. So this is one small step that we did in opening that economy and bringing tourism back to the state of Hawaii. So if you can place the video, and I'll come back and share my second use case as well, please.
The Hawaii Department of Transportation partnered with NEC Corporation to install thermal temperature screening equipment at our 5 major airports. We are the first and only state in the nation to install infrared thermal scanners at our airports.
The purpose of the installation was for the health and safety of the traveling community, the visitors, and the residents, and to prevent the spread of COVID-19. The equipment also enhanced the efficiency of the screening process because every arriving passenger to Hawaii is automatically screened and has their temperature taken as they exit the aircraft. Anyone detected with a temperature of 100.4 degrees Fahrenheit or higher is pulled aside for an additional medical screening. They are offered a COVID-19 test, and if the symptoms warrant, they can be taken to the nearest hospital.
NEC.
Thank you, Nick. And so that that implementation is live in 5 major 5 airports of state of Hawaii, and it's currently operational. If we can get to next slide or 2 slides from this one. Yeah, thank you so much. So one of the other examples where we've assisted with the resumption of global travel is our partnership with Star Alliance. As you well know, Star Alliance is a consortium of the 26 airlines. And our partnership initiated prior to COVID, but obviously COVID brought a sense of urgency and need to it. So what we've done with our implementation of Star Alliance is implementation of a identity management platform and creation of an identity that can be initially created on the traveler's mobile phone using the airline app, where we document, where we can do biometrics verifications and document validation. And that identity through that app could be used throughout the travel journey, providing a touchless experiences throughout the airport. So if you can show the next video, Nick, I would appreciate that as well.
Customers are now expecting less contact in the customer experience. And biometrics fits in very nicely. And that's really been the focus with NEC to make sure that we're able to deliver this solution at a very critical time as we emerge from this crisis. In the longer term, we look forward to enhance this solution. This may be duty-free purchases, car rentals, boarding of trains, wayfinding in airports, or hotel check-ins. And in NEC, we believe we have a good partnership to be able to drive and deliver on this vision.
NEC.
Thank you. And I think if I go to Jason's presentation, it says, which one of those three choices drove your digital transformation? And it was COVID. Obviously, I can attest to that the COVID has driven the digital transformation, at least for our part, and the solutions that we provide to the aviation industry. So where we believe is we've done with part of this transformation is to provide, to take into consideration all the stakeholders, the traveler, the airlines, and the airports. And through the digital identity management platform, we believe that we've provided a secure and more private. We are, for example, the solution that we've provided to the Star Alliance is GDPR compliant. And we have, obviously, the privacy of the traveler in mind. With the airlines, we've included efficiency, and also for the airports, the added safety and security of knowing who's traveling and the consent that they've given in use of their digital identity throughout the airport. If you can go to the next slide, please. So our vision at NEC is to really provide an enhanced experience beyond the airport. And this is where we believe our digital identity management platform can help enhance that experience, not only at the airport, but throughout the travel journey, at hospitality, at the hotel, in sport venues. And potentially this platform can be a one identity platform that can be used throughout the travel journey and other experiences that we can have. And the platform, as I mentioned, it's very important for us to say that is scalable, interoperable, with privacy and security in mind. And those are the guidelines for which we've designed this platform. Finally, if I can just summarize in the next slide. So we believe that our digital ID, we call it the NEC iDelight, because I think Lei-Lin, you called it because of the positive experiences. Hopefully we'll get past COVID. We'll provide a platform where we can actually get past this thing and hopefully resume global travel while providing convenience, safety, security, and privacy to the travelers.
Thank you, Rafi. It's interesting. I saw in the press just this week that in Heathrow, it takes 20 minutes per passenger to check paper test results and passenger locator forms and the likes. And so I think we can be optimistic that there are solutions on the horizon that will truly transform and the current day experience for travelers. So thank you all panelists. We have come to, I suppose, the time that we are all have all been looking forward to, which is the open Q&A session. So please, again, remember to send your questions in. And I will just defer my own questions in favor of the ones that have come on stream. And the first question comes is for Jason. And I'll just read out the question as it comes. Great to see the initiatives for interoperability of vaccine and immunity certificates. Are these solutions to get different contact? Are there solutions to get different contact tracing systems to talk to each other? And is it important for restoring travel?
Yeah, thank you, Lei-Lin, and thank you to the audience member for this question.
Jason,
I think
that's for you.
Yes, can you hear me? Okay, great. So it's a great question, and interoperability is going to be really important because whether it's for vaccine immunity or contact tracing, at the end of the day, we are only as safe or as healthy as the last person. And where it comes to vaccines, I think we can already see where that global situation headed towards. That's why Singapore is so involved in the global COVAX effort. The specific question here is about contact tracing, right? I think with contact tracing, I think you've seen, and we started to see countries around the world work with tech solution providers to provide that layer of interoperability. That's actually one of the reasons why when we came out with that first contact tracing solution back in March 2020, we also published our source code and made it freely available for people to see what we were doing. We published a white paper on the Blue Trace protocol. I think it still remains our ambition to drive global interoperability. However, I think each country still needs to focus primarily on their domestic situation, and I think that's pretty much what we've done. What is equally important is the technology is only a supporting enablement. Right? What we currently do and what we see today is there is still the need for the health authorities to talk to each other to understand which clade, a particular, which strain of virus is at stake. And these are things that, currently in the contact tracing systems, for privacy reasons, some of these important data is being left out. I think when you talk to researchers in the public health domain, epidemiologists, they do need access to way more information in order to truly get a sense of how the virus is spreading. And so I think the technology is only one layer. What's more important is the human-to-human, organization-to-organization, public health authority to public health authority relationships. And I think that's where initiatives like the WHO, bodies like the WHO, play a really critical role. I think it's great to see that, at least with the turn of this year, with the turn of the new year, that global cooperation in this domain has increased. I don't want to call out specific countries, but I think that's the general direction that we have to take. And going back to what I said, we are only as safe as the last country, as the last portion of our communities, and we need to all work together.
Leila, I may just append.
Thank you, Jason. And so I think my takeaway is that contact tracing happens within the perimeters of a country, and
there seems to be a bit of a time lag. It's like we're all sitting in Singapore.
Okay, I was going to ask, perhaps there is a little bit of, so my question really piling on top of that. Yes, there is a bit of a lag. Sorry, Jason, were you?
I was going to say, I think Chester wanted to say
the beauty of technology, so near and yet so far, no? But yeah, I was actually going to, we have a question for Chester, but if I may just try and interject to ask Rafi a question on the back of the one Jason just answered. It occurs to me that contact tracing is possible within the perimeters of a country, and that's what Trace Together is all about. There's a lot of contact, however, in the air when someone is traveling from one city to another, which is really, no one's taking care of that. And so I guess, Rafi, how are you thinking? It sounds like you are the one positioned on this panel to try and address that. So, so city A, city B, you can do contact tracing. But as passengers travel between A and B, I mean, are you thinking of solutions in that space, in that tube, if you call it, for contact tracing?
Well, I think that's a very challenging, obviously, proposition and challenge that I think needs to be overcome. But I can tell you, with regards to all of these challenges that I think Chester and Jason has done, the only way these challenges could be overcome is through standards and interoperability and communications between airlines, airports, healthcare, governments, and everything else, right? There is no one entity, in my opinion, and obviously I look forward to the input from the panelists as well, that can really, have a magic wand and says, I'm going to do all of these things. And what I like about, and I agree with Jason and his comments earlier, is that this global, I really have felt that COVID brought, in a way, distanced us in a way, but also brought us together. Now, for the first time, I think there is, we see IATA coming up with an app. We see NEC providing technology with experience. We see the healthcare officials providing things that perhaps in the past they would not have done. We all consider the privacy of the travel. So yes, we are reviewing all those things, but I believe that the end solution will be dependent upon even a close collaboration between all the stakeholders, including government, airports, airlines, individuals, cities, and everything else. Because at the end of the day, if we can provide that seamless experience, I think everybody will also log in and actually join the bandwagon, I guess, which, as Jason said, will make us all safer.
Thank you, Rafi. And now we have a question, and Chester, I'm sorry I sort of interjected, but there's a question for you, and please continue with sort of the comments you're going to make. And the question is, are you working with digital ID ecosystem players on digital ID plugins for the certificates?
Yeah, so I'll quickly finish a thought of the prior discussion, then address the question. I wanted to follow up on both Jason and Rafi's point that taking Trace together is a really interesting case, because even just listening to Jason's soothing voice on this video cast, you can see why Singapore has so much trust in their digital infrastructure. I would say Singapore as a country is relatively trusting of its own digital infrastructure in a way that France is not. So we deal with the country of France. They're up in arms protesting even the smallest incursions into data privacy. And so I think one thing that's incredibly important as we all move forward is to retain the trust in these systems, because ultimately that's what allows you to do new things. Because even Trace Together, I mean, it's critical for COVID-19. If you happen to be a murderous criminal, it could also be potentially used to find you and make sure you don't murder other people. That is, that's a public good, but one can imagine, that would be a concern for data privacy as well, as the government manages that. That was a single news item in Singapore, and without much tail. So again, it just goes back to, if you are a trusted custodian of the information, indeed, as long as you have that foundation, then you can really move technology forward quite nicely. And I think that GovTech somehow has managed to do that. So it'd be fun to hear Jason's view on how their level of transparency versus technology balances that. With regard to digital ID, within our system, which is remarkably similar to the OpenCert system, by the way, we are working with. It's all fun and games until the Ethereum price goes up to 1,800. By the way, but our digital ID system, we're working with providers for that. But the reality is, our strength is bringing stakeholders together to solve problems today, and at the moment, trying to put digital ID into the network right now would create friction to adoption. So our feeling is, let's get stakeholder agreement, a basic technology, which is non-exclusive. I mean, plenty of other room for lots of technologies in this space, but let's try and get some agreement about process and technology foundation first, and then we use that network to actualize, more advanced concepts like a true traveler digital ID. And for that, we're part of the ID 2020 and GHCP and some of these groups who are working on that solution. Back to you.
Thank you, Chester. There was a question about digital ID ecosystems.
So yes, we're ready to implement digital ID, but the reality is our stakeholders so far have not asked for it. So okay. I think they will soon.
I'll repeat the question. Are you working with digital ID ecosystem players?
Okay. Well, I'll repeat the answer. So the answer is yes, but to impose that on the system now would would create a bit of friction.
No, please go ahead. Continue. Yeah.
Yeah. I think back to you. Yeah.
Okay, thank
Actually,
you. And we do have I know you posed a question back to Jason, but perhaps I would ask the next audience question, and Jason can answer as part of it. Yes. And there is a question for Rafi, but I think Jason, if you could also respond to this question. So Rafi, how do recognition systems and technology, these might be a privacy issue in some countries or economies. How open or accepting are certain jurisdictions to these technologies? So I guess the question for you is broader, and perhaps then Jason could address, sort of that from the local perspective.
No, I appreciate that. And as I mentioned earlier, I think privacy and the respect for privacy and use of biometrics towards identification purposes is key to our development. And let me tell you perhaps one of the things that we address these things. So so first of all, our enrollment in our digital identity platform is consent-based, right? So it's the traveler who consents to actually enrolling in the program and also using their biometrics for that travel. The consent could be very specific, could be for that day of travel only, could be customized to the airport or even one travel journey or extended period of time. And as I mentioned earlier, before we went live with the implementation of the Star Alliance, we went in front of the GDPR, we presented the case, we were able to obviously get the approval, and then we've been able to roll it out. So with regards to the use of the biometrics, it is a consent-based, it is privacy by design. We obviously take that into deep consideration. And the good thing about NEC is that we've been in biometrics business for an extended period of time, and our technology has really performed well based on third-party NIST standards as well. So I hope I answered your question, Layden.
Okay, and maybe if I can just jump in the interest of time. I understood the question to be triangulating towards trust, really, and I would agree.
Thank you.
With what and Rafi
That's
said.
perfect. So you know what, panel members, we are coming to the top of the hour. So I would take as an indicator the tremendous success, because there are more questions from the audience that we have time for. But this is the perfect time to encourage everyone to visit each of you in your speaker booths. And with that, I'd like to thank all of you for your participation today and hand it over to Jen.